Hello and welcome to Eco-Terrorism. I'm Zeinab Bailoun. We've been discussing water for the past few weeks, so today we'll be moving into the issue of waterborne diseases, a phenomenon that greatly affects countless people around the world. Here to discuss this issue with us today is Ms. Majd Saleh, an epidemiologist. Thanks for joining us today.
Thank you for having me.
So before we start our discussion for today's episode, let's take a look at this short report.
Water pollution or water contamination is the impurity of lakes, rivers, groundwater, oceans, or any water body. Such impurity is a result of the presence of huge amounts of harmful compounds, for example, feces in these water bodies, without being adequately treated. Water pollution's effect is destructive on water ecology, plants, organisms, and humans. In almost all cases, species living in contaminated water are likely to die, and the natural biological communities located in water bodies are also expected to be destroyed. Nowadays, water contamination is one of the most global political, social, and economic concerns that require systematic evaluations and study in order to come up with international water resource policies, starting from the individual level through raising public awareness. According to the second UN World Water Development Report, more than 1 billion people who constitute 1/5 of the world population lack access to safe water and to basic sanitation as well. One of the leading environmental world scientists, Gary White, stated that water contamination is the #1 cause of death and diseases, encountering in this sense more than 14,000 daily deaths. Wang Jinan, a Chinese environmental researcher, told the New York Times that more than 500 million Chinese lack access to safe drinking water in China's cities, and that around 90% of local cities suffer from some degree of water contamination. Moreover, The Economist magazine estimated that India encounters nearly 700 million people with no access to proper toilet, and that diarrheal sickness is the cause of 1,000 Indian children's death every day. How can we save the water ecology? How much is the water pollution dire on the global level? And how can we protect our local drinking water?
So, Ms. Saleh, the video was about, or the report was about water pollution. So how would you connect, to start with, water pollution with waterborne diseases? And how would you say they're related?
Well, water pollution does lead to the water being contaminated with maybe viruses, bacteria, parasites. Mm-hmm. So that in turn leads to waterborne diseases.
Mm-hmm. So what exactly are waterborne diseases?
So waterborne disease, I mean, simply put, is or are diseases that are transmitted through the ingestion of contaminated water.
Mm-hmm. So usually it's caused by microorganisms present in human or animal feces.
Yes, exactly. Mm-hmm. So it could be anything. It could be a virus, it could be bacteria, it could be a parasite, and sometimes it could even be chemical. Mm-hmm. But most of the waterborne diseases we're seeing are usually bacterial or viruses. Mm-hmm. And yeah, they're mostly transmitted through animal or human feces in the water, and later people ingest it, and that could cause diseases.
So it's usually oral ingestion that causes these waterborne diseases to enter the human body.
Exactly. That's why it's called waterborne, because you ingest the water, and in turn you're acquiring the disease.
Mm-hmm. If you're not drinking the water, is there any other way that you can also be contaminated or affected by these waterborne diseases?
It could be indirect. For example, sometimes when we've got problems like in areas where they're prone to have waterborne diseases more than other areas, sometimes even vector-borne diseases could arise. Mm-hmm. Like, for example, malaria in some cases. Malaria is a vector-borne disease. It's transmitted through mosquitoes. But these mosquitoes' habitats are polluted water. Mm-hmm. And so that could be another indirect way of acquiring a disease, which is originally from water contamination.
So they could also come in from through the eyes, the nose, open wounds. These are also other ways.
Yes.
But they're probably more rare than the other.
It's mostly the ingestion of water. Mm-hmm. Yes.
So high standards of hygiene and sanitation, you would say, are probably how we can prevent being contaminated by such waterborne diseases?
Yes, exactly. That's basically it. If there's proper sanitation and good hygiene, we could decrease waterborne diseases. Maybe 90% of it could be decreased. So basically, there should be clean water, and at the same time, good sanitation. Like, for example, people washing their hands, having proper sewer systems. It's a structure. It should be like a big structure to lessen waterborne diseases. So
what about the fact that these diseases may also be infectious? Say that someone goes to such an area, ends up contaminated by such a waterborne disease, and then they affect other people as well. How can these other people prevent this from happening? Is there any other way?
Through sanitation and hygiene, like washing hands before eating, boiling the water before drinking or cooking. So these are the basic measures people could do to prevent themselves from acquiring waterborne diseases. But sometimes it could be foodborne, like people could acquire a disease through waterborne diseases and then maybe cook, and that way they'll be transmitting the food through the food, the diseases, through the food.
So what about the people who are affected by this? If the systems aren't in place, say by the government, if there isn't water sanitation systems, if there aren't any of these existent in place, what are people supposed to do?
So it goes back to sanitation and hygiene. That's what they should do.
But in many places, it's more difficult for such sanitation.
It's very difficult. That's why the WHO, and, along with the UNICEF, they're working on regularly monitoring water. It's called WASH, which is Water, Sanitation and Hygiene. So what they do is they go to areas which could have unsafe water, unclean water. They do assessments and they try to work on programs to improve it. And having access to safe water is also a Millennium Developmental Goal. It's one of the goals the UN drew a long time ago. And they decided that by 2015 they should lessen the amount of people that do not have access to safe water. Now, according to some reports that have been released by the WHO, they're reaching the goal. There are some areas where the goal has been achieved. However, unfortunately, it's not even, and there are still some places that do not have access to safe water, but they're trying to get there.
So it's not only about personal hygiene, it's also about access to safe water in the first place.
Exactly, yeah. Like, for example, in crises, there should be a very close water source. Like, for example, having water in a closer to your, for example, tent, wherever your shelter is. So the closer the water is to you, the more likely you're going to be using safe water. So that's another. There are several standards where sanitation comes into play.
So there are a few points I wanted to go through today during today's episode. The first is that 1.1 billion people around the world lack access to an improved drinking water supply, and many more drink water that is grossly contaminated. So what does this tell us about how many are at risk today?
Yes, exactly. There are a lot at risk. Like I mentioned earlier, the WHO and UNICEF are trying to lessen the number of people who don't have access to safe water, but it's uneven, and there's some places that still don't have access. So I think this goes back to how well the WHO, the World Health Organization, or UN agencies can work to solve this issue. Because in poor areas, sanitation isn't very easy, and I guess they need help. But up until now, good sanitation and hygiene, it's the best way to, just for basic prevention methods.
So 1.1 billion, as we said, lack access to an improved drinking water supply, but 4 billion cases of diarrhea occur annually, of which 88% are attributable to unsafe water and inadequate sanitation and hygiene.
Yes.
So it's not only the people who are directly exposed to this water, as you said, it's also due to the food that they may be exposed to. It's perhaps from infections that they may get from other people.
Yes.
How extensive do you think this problem is today, considering it affects more than half the world?
Yeah, well, diarrheal diseases, it's when someone acquires a disease, a waterborne disease, or maybe even foodborne, and one of their symptoms is diarrhea, it should be treated directly. And so the areas where treatment is hard to get, they usually suffer more, and that leads to more deaths. Like, for example, in Africa, they have a lot of deaths due to diarrhea, and in some areas in Asia, they also have a lot of deaths due to diarrhea. Now, also it depends on the disease. For example, cholera, it causes an abrupt start of diarrhea, and it can be fatal if it's not treated directly. And so it all depends on how fast they have access to health. For example, in developed countries, or middle class countries, when someone has diarrhea, it's easy to prevent. However, in very underprivileged areas, it's not easy at all. Especially children that are younger, are less than 5 years old. Most of the deaths occur at that age group, because first of all, their immunity is very low, and if there's no fast treatment, they could easily die due to simple diarrhea.
How many more cannot escape poverty? I mean, look at the cycle that's occurring. How difficult is it for people to get out of it?
Well, it's very difficult. In some areas, it's very hard to get out of it. However, the United Nations and the World Health Organizations have started something new called Zero Hunger. I don't know if you've heard of it. So they're trying to lessen this gap, where people are dying from lack of safe water and hunger. And so they're trying to do this nutritional programs in order as to lessen the deaths that might occur from malnutrition and poverty. However, poverty, it's a very wide issue, and it requires political and social factors working together. Yes.
We'll be coming back to this issue right after the short break, so please stay tuned.
Around the world, outside the mainstream, anywhere, everywhere. A media of your land, of your creation. A new media in a new era. Will it take the lead in the future? I believe so. This is Underground.
Underground, when vague turns to clarity.
Time. Variable. Event. The only constant variable in life is change. Broader perspective. Arguments and counter-arguments on our platform.
Global insights. The globe on our platform.
Welcome back. Let's take a look at this short video before we continue our discussion that gives us an insight into the importance of water in Africa specifically.
Water. It's life's most basic need. But there's a water crisis in our world right now. Seriously, a crisis. Nearly 1 billion people live without clean drinking water. It's happening all over the world, especially in developing areas of sub-Saharan Africa, Southeast Asia, and Latin America. It's a water crisis because it starts with water. But water affects everything. Education, health, poverty, and especially women and children. Let's look at a family caught in the water crisis. It's likely they live on less than $1 a day. When they're thirsty, they can't just turn on the faucet for a nice cold glass of water. They don't have a faucet. Instead, the women and children go off to collect water. Many walk up to 3 hours a day to the nearest swamp, pond, or river to gather water that's been sitting out in the open, exposed to all kinds of germs. Time spent gathering water is time they can't spend learning to read, write, earn an income, or take care of their family. Some women in sub-Saharan Africa spend more time collecting water than any other activity they do in the day. And the walk isn't just hard, it's dangerous. The women are alone and burdened with 40 pounds of water. Many get hurt. Sometimes they're even attacked. When they make it home, the little water they've collected isn't clean. Some families know their water is contaminated with germs that cause diarrhea, dehydration, even death. But what choice do they have? Kids, especially babies, are affected most by these germs. About every 19 seconds, a mother loses one of her children to a water-related illness. And each day, almost 1 billion people are living this way. Until they get a little help. The water crisis is solvable. There are solutions. Some are brand new and innovative, like water filtration systems. Some are age-old, like drilled or hand-dug wells. These solutions bring clean water much closer to the people who need it. A safe water project near a village restores hours each day to a person's life. This time, it's opportunity. It's freedom to go to school and get an education, to work or start a business, to raise a family. Africa alone could save 40 billion hours each year. That's the entire annual workforce of France. Clean water means less disease. That's less money spent on medicine, which means more money for books and school uniforms. And if the water project is built near a school, it can increase attendance, especially among young girls. The water crisis is vast, but we can solve it.
So we saw in the video how important water is and how big of a part of so many people's lives every day it is. How do you think we can, or how big do you think the obstacles are that we face in trying to make sure that safe and clean drinking water is available to everyone, regardless of where they are, regardless of their economic situation?
Well, it is difficult because, like I said before, it's a structure. It's a big structure. Sometimes it's social and sometimes it's political. Because, like for example, in Africa, as they mentioned over here, there's a big number of people living in poverty, and so if the issue of poverty isn't solved, I don't know if how well waterborne diseases are going to be decreased. Mm-hmm. So working on water alone isn't just enough because. Like for example, they mentioned also education. There's low education, so the lower people are educated, the less they're going to know that they're taking unclean, unsafe water. And so I think it's a big system, like starting with education, and the political structure should also come into play over here.
So since we're talking about education, let's say we move to the issue of awareness, and it's kind of a cycle, as we mentioned before, that many people aren't able to get their educations because they're trying to search for good water, or because they're trying to, just live out their daily lives. Yeah. So how can we educate people about the importance of, finding good water or, good hygiene if they aren't able to subscribe to such education systems or to follow through with such
sometimes
programs?
it's also the other way around. So let's say we educate them, but they still they're not close to a clean water source. So it's like a sort of like a cycle. So yes, if we educate them, they probably know better. For example, they'd probably boil their water or form other or treat their water at least. And so yeah, education could solve a little part of this whole problem. Yes.
So we've been talking a lot about Africa. What about other regions in the world that do suffer from such problems? Waterborne diseases.
Well, there's a recent case, for example, Philippines. The Philippines, they went through typhoons and floods, and so there was a lot of diarrheal diseases reported after the crises. They're also right now having problems with vector-borne diseases, and vector-borne diseases could also be related to water that's not clean. So that's another example where they're suffering from unclean water. And in the report that that was shown at the beginning, China also suffers from unsafe water. So I think even if we're going to talk about Lebanon doesn't have very much clean water either. Yeah, but the thing is, people usually, here in Lebanon, people usually try to find treatment like right away. And yeah, so that's it.
A lot of these problems are preventable. I mean, the WHO estimates that 94%, for example, of diarrheal cases are preventable through modifications to the environment, like interventions to increase the availability of clean water and to improve sanitation hygiene.
Exactly.
So the problem isn't with the availability of technology or the availability of ways to deal with it. The problem is with the implementation.
Exactly, and awareness. People should be aware that if they feel like the water isn't clean, they should take some measures into making it better to ingest.
Mm-hmm. What are the main solutions that are being implemented, and how effective do you think that they are?
Well, solutions for now are programs, implementing programs, like the WASH program I mentioned earlier, water, sanitation, and hygiene. Up until now, they've shown to be a little effective. However, they're not even. So by 2015 or 2015, I'm not sure the Millennium Developmental Goal of access to safe water is going to be met, because the programs are implemented evenly. However, it's better than before, but they still need to work on it.
Do you think there will be change for the positive, for the better?
Well, we should always hope for the positive. Hopefully there is, but the problem is with waterborne diseases is that even if you set a program, sometimes some crisis might occur. It could be internal conflict, it could be floods, it could be typhoons like in the Philippines, and so maybe these diseases might reemerge. And so sometimes you can't really plan ahead, but in general they could be preventable, as you mentioned earlier.
Thank you very much for joining us today in the studio. Thanks to our guests in the studio, Ms. Majd, Saleh, and to you for watching. So before ending the episode for today, we'll be showing a short video about water contamination in South Sudan. So please stay tuned. This was Eco-Terrorism, and I'm Zeinab Bailoun. See you next week.
There's no option other than going to open wells, places like swamps, where there's stagnant water, even along the road, you know, where water stands. People, women get water, access water from there, and they serve the family members with this water, because this is the only way they can get water. When people get sick, you know, it actually destabilizes the economy of, let me say, of that particular family, because the little money they get will all go for health issues, you know, to just for treatment, instead of using that money for other developmental issues in the family. The end result is they resort to use that money to actually heal themselves, to go for health facilities.
Narake ndia jur loi kide nagon kugada de gadi piong ko na mama ta buru asan yini ke kida ni na imo jukine piong na muto kolari ma.
As a humanitarian service worker, we feel we have actually saved people's life.
Ambilila nguna chunyun takati Amerika yo kitata na kendai ina pirina